Hey everyone, welcome back to all my listeners. This is episode 10 in season 17. Today is Wednesday, April 8th, 2026. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. All right, you guys, so I hope you enjoyed last week's replay drop. I featured my very good friend, Keisha Wilson. We had an interview a while back, and I wanted to make sure much of the world gets to hear this amazing interview I had with her. So it is on replay as of last week. So make sure you go back and check it out. But it is already the second Wednesday of the month, and my audience knows what that features. That's right. Drum roll, please. It is the OIG Work Plan updates for the month of March 2026. And of course, in my Trusty tip, I'm going to go ahead and talk about a very quick heads up here in my region for my local MAC. And I'll go ahead and close out and round out today's episode with a remarkable quote on beauty, abundance, and innovation by Gloria Steinem. All right, you guys, let's get into it. So in today's Newsworthy, the month of March's OIG Work Plan updates, I want to go over the fact that there were 8 updates made for the month of March 2026. Now, the first OIG Work Plan update for the month of March 2026 is titled Treatment Planning and Medication Monitoring for Children in Foster Care Receiving Psychotropic Medication. Now, this report is expected from the Office of Evaluation and Inspections. The OIG previously found that in 5 states, 1 in 3 children in foster care who were prescribed psychotropic medication in fiscal year 2015 did not receive treatment planning or medication monitoring as required. Now, 10 years after the OIG's review period, high rates of psychotropic medication use among children in foster care remain concerning. Although psychotropic medications can be effective treatments for children in foster care, they should be used as a part of a comprehensive treatment plan, and the children who are prescribed them must be closely monitored by providers. The OIG will use foster care case file documentation and Medicaid claims data to determine whether children received treatment planning and medication monitoring in accordance with applicable requirements. For 5 selected states, the OIG will assess the extent to which children in foster care who were prescribed psychotropic medications received, number 1, screening, assessment, and treatment planning, and number 2, medication monitoring consistent with state plan requirements. Additionally, the OIG will explore with states and Administration for Children and Families potential causes for any non-compliance with state plan requirements and potentially beneficial practices implemented by states with high rates of compliance with state plan requirements. This final report is expected in fiscal year 2028. Now, the second OIG Work Plan update made for the month of March 2026 is titled Congressional Mandate, Non-Covered Versions of Part B Drugs in 2025. Now, this report is expected from the Office of Evaluation and Inspections. Under the Consolidated Appropriations Act of 2021, Congress directed CMS to remove non-covered self-administered versions of Cimzia and Orencia from Medicare Part B payment amount calculations beginning in July 2021, and if doing so, that would lower payment amounts. Now, through the same legislation, Congress required the OIG to conduct periodic studies to identify additional drugs for which non-covered self-administered versions are included in Part B payment amounts and which OIG determined should be excluded from Part B payment amount calculations. Accordingly, the OIG will conduct periodic studies to identify drugs for which non-covered self-administered versions should be excluded from Part B payment amount calculations. In general, for the drugs that the OIG identifies, CMS is required to remove non-covered self-administered versions from payment amount calculations in subsequent quarters if the exclusions would result in lower payment amounts. However, the statute provides CMS with some discretion in addressing the requirement. This final report is expected in fiscal year 2028. Now, the third OIG Work Plan update made for the month of March 2026 is titled Audit of Medicare Payments for Chronic Care Management Services at Risk of Noncompliance. Now, this report is expected from the Office of Audit Services. Chronic care management, or CCM, is care coordination that occurs outside of a regular office visit for patients with 2 or more chronic conditions that, number 1, are expected to last at least 12 months or until the patient dies, and number 2, places the patient at significant risk of death, acute exacerbation or decompensation, or functional decline. Now, effective January 1st of 2015, CMS established a policy for Medicare to pay under the Medicare Physician Fee Schedule for CCM services rendered to enrollees whose medical conditions meet certain criteria. From calendar year 2019 through calendar year 2024, Medicare Part B payments for CCM services increased substantially. The OIG will review Medicare Part B payments for CCM services that may be at risk of non-compliance with the Medicare requirement for multiple chronic conditions. This final report is expected in fiscal year 2028. Now, the 4th OIG Work Plan update made for the month of March 2026 is titled Evaluation and Management Services on Same Day as Minor Surgery with No Modifier 25. Now, this report is expected from the Office of Audit Services. Generally, Medicare reimbursement for an evaluation and management, or E&M service performed on the same day as a minor surgical procedure is included in the payment for the procedure. However, Medicare makes an additional payment for a significant and separately identifiable E&M service provided on the same day as a minor surgical procedure. To identify these significant and separately identifiable E&M services and bypass automated system edits, Medicare instructs physicians to append Modifier 25 to the claim. Analysis of Medicare paid claims data for E&M services provided by Part B providers during calendar years 2023 through 2025 identified payments for E&M services performed on the same day as a minor surgical procedure that were processed and paid without a Modifier 25 appended. So the OIG will determine whether the Medicare Administrative Contractors, the MACs, processing and payment of these E&M claims complied with Medicare requirements. This final report is expected in fiscal year 2028. Now, the 5th OIG Work Plan update made for the month of March 2026 is titled Inpatient Claims for Neurostimulator Implantation Surgeries. Now, this report is expected from the Office of Audit Services. Certain medical devices, such as neurostimulators, may be implanted during an inpatient procedure. Medicare covers the initial implantation and replacements or revisions to the device. Hospitals must meet federal requirements for neurostimulator implantation surgeries to be covered by Medicare. Prior OIG audit work determined that Medicare made improper payments to hospitals for outpatient claims for neurostimulator implantation surgeries. Currently, CMS requires prior authorization for outpatient neurostimulator implantation surgeries, but not for inpatient neurostimulator implantation surgeries. Prior authorization helps CMS ensure that applicable requirements are met before the services are provided. CMS's lack of prior authorization for inpatient neurostimulation implantation surgeries may leave this area vulnerable to potential improper payments. The OIG will determine whether CMS made Medicare payments to hospitals for inpatient neurostimulator implantation surgeries in accordance with federal requirements. This final report is expected in fiscal year 2028. Now, the 6th OIG Work Plan update made for the month of March 2026 is titled Utilization and Oversight of Medicare Part C Supplemental Benefits for Over-the-Counter Items. This report is expected from the Office of Audit Services. Medicare Advantage, or MA plans, may offer supplemental benefits such as over-the-counter or OTC benefits to support enrollee health. These benefits are funded through rebates and must be used on CMS-approved health-related items. In 2024, CMS required MA organizations to report utilization and cost data for OTC benefits. However, MA organizations have varying approaches to delivering this benefit, and there is limited visibility into how funds are spent or whether all enrollees are able to access the benefit. OIG will audit selected MA organizations to determine whether OTC benefits were being accurately reported to CMS and administered in accordance with federal requirements. This final report is expected in fiscal year 2028. Now, the seventh OIG Work Plan update made for the month of March 2026 is titled Audit of Federal Reimbursement Made to States for Certain Medicaid Services and Exclusion of Services that Should Have Been Fully Funded by States. Now, this report is expected from the Office of Audit Services. To qualify for Medicaid, individuals must meet eligibility criteria that include certain federal and state requirements for income, residency, and citizenship or immigration status. Many states offer healthcare programs that cover certain services similar to Medicaid, for example, family planning services. But those are funded entirely with state funds to serve individuals who do not meet Medicaid requirements. OIG refers to these programs as state-only programs. OIG objectives will be to determine whether state Medicaid agencies, number one, complied with federal and state requirements for claiming certain Medicaid expenditures, and number two, if they were properly excluded state-only program expenditures when claiming federal reimbursement. Now, this final report is expected in fiscal year 2028. Now, the eighth and final OIG Work Plan update made for the month of March 2026 is titled Data Brief, Selected States Medicaid Coverage of Emergency Services for Non-Qualified Aliens. Now, this report is expected from the Office of Audit Services. Individuals meet Medicaid eligibility criteria by satisfying certain federal and state requirements related to income, residency, citizenship, immigration status, and documentation of citizenship. Federal Medicaid benefits are generally limited to individuals who are citizens or nationals of the United States or qualified aliens, such as lawfully permitted permanent residents, asylees, or refugees. Many qualified non-citizens are not eligible for full Medicaid benefits until 5 years from the date they enter the United States with qualified alien status. Non-qualified aliens and qualified aliens who are subject to but have not yet met the 5-year waiting period are restricted from receiving full scope federal Medicaid benefits and are eligible only for emergency Medicaid services. However, states may elect to provide Medicaid coverage for non-qualified aliens using state-only funds. The OIG will describe which types of services were covered as Medicaid emergency medical services for non-qualified aliens in selected states and claimed for federal reimbursement. This final report is expected in fiscal year 2028. And now it's time for my best practice tips in Trusty Tip. Well, I just wanted to go over a very quick news release that was just released on April 1st by the Medicare Administrative Contractor in my region, my MAC. So it says, quote, National Government Services is now operating as Wellpoint Federal. National Government Services is operating as Wellpoint Federal effective April 1st, 2026. New name, same trusted partner. For decades, we have empowered federal healthcare agencies to improve lives and strengthen communities through outcome-driven innovation. That commitment remains unchanged. Our government partners, Medicare providers, and beneficiaries can continue to expect the same high-quality service you rely on today. As Wellpoint Federal, our name reflects wellness, and our legacy reflects trust. Together, they define who we are, a proven federal partner with deep expertise, advancing the future of government healthcare as part of Elevance Health. So what can you expect? While we embrace the opportunities of the Wellpoint Federal name, this change does not impact our team structure, service levels, or the operating model that has earned your trust for the past 60 years. As we start adopting our new brand identity, you may still see National Government Services referenced online or in existing printed materials. There are no immediate changes to our provider portals, NGX Connects, and ngsmedicare.com. We will provide updates as any changes are introduced throughout the year. Together, we are committed to a seamless, well-coordinated transition, ensuring uninterrupted service, clear communication, and continued operational excellence for our customers, providers, beneficiaries, and teams, end quote. So I loved coming across this because I'm always on the NGS website. That is where I get my news, my trusty tips for this region here, just outside Chicago and many of the other surrounding states that are using the NGS as our MAC. However, now, based on this trusty tip today, it is now going to be called Wellpoint Federal. So I really wanted my audience to know that because this is relatively new, right? As of only April 1st. So it's only 7 days old as this episode drops. So it's going to be very exciting for me to look at their brand identity and see how things will be changing over the months ahead. So wanted to give you that news flash in my trusty tip. So you can keep finding the trusted information on their website, from their MLNs to the webinars that they release to all of the news that is archived on the NGS website. All right, so I just wanted my audience to know that the NGS MAC in my region is now with the new name, Wellpoint Federal. So make sure you look out for any new updates that they release throughout the year, and make sure you continue to utilize the ngs.com website. I know I do for all of the research and education that I provide to my practitioners in this region. So, all of that trusted information is not going to change. It is just going to be housed under their new name, Wellpoint Federal. And finally, I focus a brand new season 17 spark on beauty, abundance, and innovation. I know it's been a minute since I've released a spark on the episodes, but I wanted to go back to it because I found a really great quotation that fits in beautifully. Because this 17th season spark is filled with our many world thought leaders, writers, artists, philosophers, everyone who inspires us with their insights on beauty and on abundance and on innovation. So in this week's inspiring quote in Spark is from Gloria Steinem. Don't think about making women fit the world. Think about making the world fit women. So very true, right? I love this quote on innovation. This quote makes us continue to think about all the ways we can improve the world for all, for men and women, for boys and girls. Strong women know this. Strong women show others how to do this. Women who lead, women who influence, women who inspire. They are the ones who know the world needs to fit women. I'm happy Gloria Steinem's spark burns brightly and still inspires so very many. All right, you guys. Well, that wraps up today's relatively short and sweet episode. I hope you got a lot out of it. I know that OIG Work Plan update for the Modifier 25, again, right, that really hits home to many of us in the business of healthcare world. I know I've talked about the Modifier 25 on the podcast for years, from how to utilize it effectively, how to utilize it compliantly. And this particular OIG Work Plan update is stressing the fact that maybe some of the MACs got things wrong, right? And these claims were being paid without the Modifier 25 appended on that evaluation and management code when it is on the same date of service with a minor surgical procedure. So I can't wait to see what that report actually ends up talking about. Because I know over the years, the Modifier 25 has been in the spotlight a lot alongside the dermatology types of claims, alongside those evaluation and managements. They've been in the spotlight just by themselves. They've been in the spotlight with our telehealth types of evaluation and management services. So there's been a lot going on with this modifier over the years. And here we are in 2026, they are still talking about it. So clearly a lot more education is necessary for not only our practitioners, but also for the MACs, right? We have to make sure that the Medicare processing bodies, the MACs, are actually implementing their edits timely and making sure that they are applied. So those types of claims should not be paid, right? If there is no Modifier 25 appended to it, why was that E&M paid alongside the minor surgical surgery? So, lots to unpack, lots of thoughts that I think about when I read that OIG Work Plan update. So, I have lots of thoughts, but again, I have no idea what claims they're reviewing from the years 2023 through 2025. It could be a variety of service lines, a variety of patient populations. I just don't know. But I know I'm very excited for 2028 to roll around so I can read what that OIG report actually is talking about. So anyways, you guys, I wish you all a very, very happy and stress-free week ahead. Don't forget that this entire month is a health awareness dedicated to stress. So we have to make sure that we are implementing things that decrease our stress levels and our burnout. I know I've talked about that over the years a lot on the podcast because it's important to me in the work I do. Always looking at records, always auditing, all of that causes a lot of stress, right? So we have to find ways to decompress and just celebrate life. Spring is in the air. The buds are blooming on trees. There are flowers growing here finally. I know many of you across the country have been enjoying springtime well before me, but it's finally approaching here. So I'm very, very happy and looking forward to it. So anyways, you guys, thanks so much for listening on today's episode. And I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday.